Alright, so today I'm going to talk to you about some of the basic causes of low back pain. I can't go over all of them because there are so many ways that you can have low back pain. But low back pain in itself statistically affects anywhere from 80 to 90% of Americans, and so it's something that it's very easy to prevent, and yet almost everyone will suffer from it at some point in their lives. And if you don't take care of it, it can get worse, and I'll explain why and how. So let's start off with just the basic reason. Why are you experiencing pain? Most of the time, it's the nerves running out of your vertebrae that are being either compressed, pinched, squeezed by tight muscle, etc., etc. So it's always a compressive issue. So decompression is almost always the key to fixing low back pain, and I'll show you what compresses it and how to decompress. So let's start with the hip flexor muscles. They attach to the femur and they run up through your pelvis and grab hold of the T12 vertebrae and all 5 of your lumbar vertebrae. You got your psoas major, which is this big one here. Your psoas minor is also part of this group, and it comes down and it attaches to the ischial tuberosity of the pelvis. And then you got the iliacus, which runs from the same point here on your femur to the inside of the hip bone, the iliac. So when you're sitting all day, these muscles get shortened, and if you sit for too long, they stay shortened and they adapt to that shortened position. So what happens when you try to stand back up is they'll tug on your vertebrae and won't let you fully extend and stand straight up like you should. So that's causing a vertical compression on all of these vertebrae, which will eventually, in worst case scenario, lead to herniated disc. So one thing to be aware of is you should not spend too much time at once sitting in a chair. I try to avoid anything beyond an hour straight. After an hour of sitting, you need to get up, walk around, loosen up your hip flexors again, try to do some stretches, which I'll show in another video. Just don't let them adapt to that shortened position. Let it be a temporary position. So once you get up out of your chair, you walk around, you sit back down. You also need to be aware of your piriformis muscle. This is another way you can have back pain. The piriformis is an external rotator. It takes the hip and it moves it outward like that. So the piriformis runs from the tailbone, the sacrum, behind the pelvis and attaches to the backside of the femur. And see, maybe you can't see it very well, but the yellow line here, that's your sciatic nerve. The sciatic nerve runs either underneath or actually through the piriformis muscle. So when the piriformis is tight, it'll squeeze or pinch the sciatic nerve, which causes sciatica. That's a shooting pain down the leg that you hear of all the time. So sciatic nerve wants room to breathe. So this is piriformis syndrome is also called toilet bowl syndrome, because when you sit on a toilet, it's directly applying pressure to that piriformis. That's that muscle that if you sit on the toilet too long, maybe your feet get to tingling a little bit, or you get up and you have back pain after sitting too long, you need to stretch that piriformis back out, and that's something I'll address later. So let's get to disc issues. Another way you can have sciatica is a herniated disc. Now, the nucleus belongs in the center of the disc. Think of a disc as a jelly donut. The nucleus should stay in the center. When you have compression, it gets squirted out, basically. It gets pushed out until it finally breaks through and herniates. And as you can see, these yellow lines, that's a nerve running through these little spinal canals. And if your disc herniates, it can push against that nerve, sandwiching it between two bones, basically part of the spine's process. It will sandwich the nerve and cause inflammation. And the inflammation and the irritation, that's the low back pain that you feel in the sciatica running down the leg. Even if you're only bulging, you haven't fully herniated, which is when the jelly actually comes out of the disc and spills into the rest of your body, you can still have the bulging that pinches the nerve up against the bone. If you have a full herniation, meaning that the liquid spills into your body will treat it as a foreign object, because the only place that this nucleus pulsus resides is inside intervertebral discs. So your body doesn't recognize it anywhere other than in a disc. When it comes out, inflammation occurs, your body thinks it's like a foreign object, it goes in there and attacks it, and all that attack and this the war that's going on will just cause just pure inflammation of the nerve, regardless of it being pinched against the bone. So that's why, obviously, you don't want a herniated disc. It's painful and it's a long recovery time. Another thing is L5S1 compression. The psoas pulls vertically down on these discs, but it also causes an anterior tilt. So what I mean by that is, when you sit all day, you get tight hip flexors, and you get a tight back from trying to arch yourself back up. So what this does to your hips, this is your hips, and I'm facing this way, you end up with weak abs, weak glutes. So these two here, you have tight back and tight hip flexors. So they're all gonna work to pull and turn that pelvis forward like that. That's an anterior pelvic tilt. And what that does is, this is your sacrum and your hips are kind of, covering over it like that. If you tilt the entire pelvic system, right here at the L5S1, that's where most of the compression occurs. So instead of a rectangular amount of space, you're essentially causing a triangular squeeze. And so the jelly's eventually going to want to squirt itself out. So that's anterior pelvic tilt. Be sure you don't have that. Best way to fix that, along with stretching, which I'll show you in another video, is to always keep your glutes active so that you're squeezing and tilting. If you're squeezing your butt, you should feel this little bony part of your hip here and the bony part of your back of your hip. They should be the same level. They should not be one above the other. So those are some of the main reasons of back pain. Like I said, there are many other ways, but I can't address them all in one video. It'd be way too long of a video. So let's see how we can stretch that out, fix it.